What is polio? Poliomyelitis is a disease caused by poliovirus. It causes mild or no symptoms in most people, but in some people it can cause paralysis or death. There are three variations of poliovirus called wild poliovirus type 1, 2, and 3 WPV1, WPV2, and WPV3. Wild polio types 2 and 3 have been eradicated, no longer exist, and wild polio type 1 only exists in a few parts of the world. Polio type 1 is most likely to cause paralysis. How polio does affects your body. Poliovirus gets into your body through your mouth or nose. It makes more copies of itself, reproduces in your throat and gut intestines. In some cases, it gets into your brain and spinal cord and causes paralysis. Paralysis can affect your arms, legs, or the muscles that control your breathing. Who is at risk for polio? You're most at risk for polio if you aren't vaccinated and you live in or travel to an area where polio hasn't been eliminated, live in or travel to an area with poor sanitation, are under 5, are pregnant. Can adults get polio? Yes, adults can get polio. Many adults have immunity, either because they're vaccinated or they've had polio. Adults who aren't vaccinated can get polio if they're exposed to poliovirus. What are the symptoms of polio? Here are the symptoms associated with polio. Mild symptoms. Many individuals infected with the poliovirus exhibit no symptoms at all. For those who do, the symptoms are often mild and flu-like. These may include fever, sore throat, headache, fatigue, nausea, stiffness in the neck and back. Non-paralytic polio. Some people may develop a more severe form of the disease known as non-paralytic polio. In these cases, symptoms may include muscle stiffness, pain or stiffness in the limbs, particularly the legs and back. Meningitis-like symptoms, such as sensitivity to light and neck stiffness. Paralytic polio. In a small percentage of cases, polio can lead to paralysis. Paralytic polio can develop after the initial mild symptoms have subsided. Symptoms of paralytic polio may include sudden onset of muscle weakness or paralysis, often starting in the legs, loss of reflexes, severe muscle pain and spasms, difficulty breathing or swallowing if the muscles involved in these functions are affected. It's important to note that while most individuals recover from polio without lasting paralysis, some may experience long-term complications including muscle weakness, paralysis, and even lifelong disability. How is polio diagnosed? A healthcare provider diagnoses polio by performing a physical exam, testing samples of body fluids, and asking you about your symptoms. It's important to let your provider know if you've traveled anywhere recently. Your provider might take samples of body fluids to look for signs of polio or other infections, including spit, saliva from your throat, poop, stool, blood, cerebrospinal fluid, liquid around your brain and spinal cord. Because polio symptoms look a lot like flu symptoms, your provider may do other tests to rule out more common conditions. How is polio treated? There are no specific medications to treat polio. If you have paralytic polio, you'll receive physical therapy. If your breathing muscles are weakened or paralyzed, you'll need mechanical ventilation, a machine that helps you breathe. You might be able to improve your symptoms by drinking fluids such as water, juice, and broth, using heat packs to help muscle aches, taking pain relievers such as ibuprofen, doing physical therapy, and any exercise recommended by your healthcare provider. Getting plenty of rest. Prevention. The best way to prevent polio is to get vaccinated. Vaccination is usually done in childhood. If you didn't get vaccinated as a child or don't know if you did, ask your healthcare provider if you should get vaccinated. Recommended polio vaccination schedule. Healthcare officials recommend 4 polio shots in childhood. First shot at 2 months old. Second shot at 4 months old. Third shot between 6 and 18 months old. Booster shot between 4 and 6 years old. If you've never been vaccinated for polio and it's recommended you get vaccinated as an adult, you'll get 3 shots. 2 doses 1 to 2 months apart. A third dose 6 to 12 months after the second. Adults at higher risk for polio. Your healthcare provider might recommend you get a booster dose of polio vaccine or get vaccinated as an adult if you've never been vaccinated. If you are planning to travel to certain areas of the world where polio still exists, work in a lab where you might come into contact with poliovirus. Work with patients who may be exposed to poliovirus. What is the history of polio in the U.S.? Polio outbreaks began in the late 1800s, but experts believe it existed even before that. It caused many people to get paralyzed or die in the early 1900s. The worst outbreak in 1952 left over 21,000 people paralyzed in the U.S., mostly kids. Thankfully, vaccines were introduced in 1955, which lowered polio cases a lot. By 1965, there were only 62 cases. The last natural case of polio in the U.S. was in 1979. In 1994, the U.S. officially said polio was no longer a problem. But sometimes there are still a few polio cases in the U.S., mostly from people traveling from other countries where polio is still around. If not enough people get vaccinated, polio could return in the U.S.